So handing this over to Dr. Hsin to take us through this presentation. Welcome.
Thank you very much. My name is Hsin Chang. I am a medical doctor inside the Médecins Sans Frontières, Doctors Without Borders. Can you please pass to the next slide? Yeah. So what I'm going to introduce to you today, it's our solution called MSF eCare. Can pass the next slide, please. So MSF, we have been working with CHT for the past 4 years around this time, and we have done algorithms for pediatrics and what we call young infant, which is used for primary health care in humanitarian settings where we have projects. So if you see in the map, these are the implementations already done so far that are currently going on. The OCB, OCA, it means the different sections inside our MSF organization, and almost all of them are using the MSF eCare, and this is about these two algorithms, pediatrics and young infant. The vaccination algorithm was developed around 2 years ago, and we had done one pilot, which is not reflected here, and I'm going to speak mainly about this solution. And we have even a fourth one that we are still finishing to develop in STI, sexual transmitted infections, which we are also piloting in Swaziland this time. So we have a total of 10 countries using MSF eCare in 52 health facilities, including MSF and Ministry of Health facilities. Can pass to the next slide, please. So MSF vaccine. Next slide. This is the objective. It's to tackle a big problem we have in our environment of work, where children and also even adults do not have a proper immunization schedule done. Vaccination, we know from WHO that it can prevent 3.5 to 5 million deaths per year, but there are difficulties to prescribe vaccination. There are very complicated calculations to be done, and you have to take into account many parameters like the age of the patient, the previous vaccinations done, any specific conditions from the patient, like pregnancy or any diseases or allergies, the vaccination schedule to be implemented in that specific place according to the vaccination calendars decided by Ministry of Health policies. And also, if it's MSF vaccinating, we may have our own policies to apply. So sometimes even information, especially from vaccination history, it's just incomplete or non-existent. They lose their vaccination cards, the writing is very difficult to understand, etc. Then data collection can be insufficient when we are doing by paper. This is the difficulty in all the settings where CHT is being used mainly. When the data is not collected electronically, paper forms can be lost, calculations can be wrong. So the immunization coverage, which is to understand if a specific community is well covered, if you have a certain percentage of coverage, is just maybe not possible to interpret. Next slide, please. Then what is the main objective then from MSF eCareVaccine? So vaccinations are being done all around, but the specific thing we want to tackle is the missed opportunities of vaccination. If you can see on the left, this is a childhood vaccination card, a normal one, where you have the age of the child and then all the different vaccines that should be done and the dates that the health worker have to enter when they give the vaccine and the next date that the child has to come back to get the second, third round of this vaccine. Then you have on the right the calendar that is given to give the vaccination, which can change from each country or each place where we work. What's the age of each vaccine that should be given and what's the disease that is targeting. So if you have a child, for example, that does not get a vaccine when it's supposed to be getting, normally the health worker have the tendency to just check for that age which vaccine the child should receive, not considering that there are vaccines that were not given in the previous age that could be given now, that this is the missed opportunity we want specifically to tackle. And then with the electronic solution, we have a more simpler and speedy way to process the data. Next, please. So our approach is to have a tool to help the health workers prescribing vaccinations to get the right vaccine, the right time to the right patient based on the history, comorbidities, the local vaccination schedule protocol as well. And with this, we give messages so they can improve the communication with the caretaker of the child or with the patient if it's an adult, to explain them possible side effects, the importance of getting vaccination, and the date of the next vaccination. Then we want to, the general objective, to increase the immunization coverage and then lead to decrease of morbid mortality around the people not vaccinated. Then we added also some other strategies that can come together with vaccination, like giving vitamin A, giving medication for deworming, do a malnutrition screening, malaria prevention, etc. So we have incorporated this into the algorithm as well. So next one, please. So what is the target group in the end? Like I said, it's quite big. So it's the normal regular vaccination of children. It can be for catch-up vaccination campaigns, especially when it's multi-antigen that uses more than one vaccine where calculations are more complicated. Can be for vaccination during pregnancy, can be for women on childbearing age, not pregnant, migrants, elderly, people with specific comorbidities like sickle cell, asplenia that needs a different dosage of vaccines, or some vaccines are not prescribed to them, and some post-exposure vaccines for sexual violence when there is needle accident, when there is a dog bite or other animal bite. And then where do you give these vaccines? In primary healthcare centers, in mobile vaccination activities, even in emergencies, for hospital settings, for nutrition centers. Next one. So how does it work? I'm going to do a demo later, but just for you to understand the principle, it's that we have a module specifically conceived to set up the parameters. Like I said, vaccination depends on a lot of parameters. So for this module, we're going to set what's the schedule that we want in this location, according to the Ministry of Health or according to MSF protocols. And then we are going to give the tablet to be used by the health care provider, where they can see the patient with their vaccination card. They can enter all the data that is needed for checking if they have any comorbidities, any problems that can change the vaccination schedule. Input the age of the person and the vaccination history, the previous vaccines received. Then the eCare MSF eCareVaccine are gonna give an output of the list of vaccines that the health worker has to give in this consultation session, and when they should return for follow-up vaccines. And then other messages also to improve the communication with the caretaker or the patient. Next. All this while recording and transmitting non-identifiable data. At any point, we ask them for the name of the person, but data will be collected by the age, which vaccines are given, etc. And I think we are ready for a demo. Next one, please. Yeah. So if I can have the possibility to show you, let me know when I can share. And let me know you can see my screen.
Yes, I can see your screen.
Great.
Thanks.
So this is our testing system for CHT. Here we have a health facility called Gariwazam. And here we select first the adaptable parameters. Like I said, what we want to input as the schedule to be used and what type of vaccines, what type of activity we have. So first of all, what's the program? Let me just show you very quickly, just routine vaccination. What's the context? In this context, there is any contraindication, because this can be different also. In some places, fever can be a contraindication, and in others, no. Let me put just few of them: severe immunosuppression and maybe previous severe allergy. Then any other activities that you do together with vaccination. Let's say we do also a malnutrition screening. And then if you accept memory recall, like if the patient comes without the vaccination card, which happens quite a lot, like can we use the memory, what the person remembers of being vaccinated or not? Then put here that no. Then you choose which vaccines you give in this routine vaccination. Let me choose few of these. So just to show you, this one, measles, maybe let's see, just hepatitis A, for example. And then you choose a bit what are other parameters for each vaccine. So for the measles containing vaccine, what's the age, the minimum age that you can start vaccinating, which can change also according to protocol. Let's put 9 months. What type of vaccine are you giving of measles? It's a combined one or a simple one. Let's say an MMR. Or what's can you do a second measles dose in your calendar? Let's say yes. So you can see that there are some more questions. In this second dose, what's the minimum age? Let's say 12 months. Then for the DPT vaccine, when is the minimum age for a vaccine booster? Let's say 18 months. So on. So I'm putting all the information here just for you to have an idea. Oops, last one. So here for the malnutrition screening, what type of screening do you do? The severe acute malnutrition, a general acute malnutrition, etc. So let's say just general malnutrition screening. And then which service, just more for data collection, just for information. Let's say both MOH, MSF service. And now you have the tool ready for your health workers to use. Now, so adaptable parameters, eCareVaccine, it's related to MSF e-vaccination. So it feed it with all the parameters that we have to use. So you have a child in front of you. You are now the health worker. So let's answer these questions now. You are in which program? Let's say an outpatient program. Then the beneficiary, the child, does it has any signs of severe disease? If you say yes, it says that it's an absolute contraindication in any type of case. So you should call for help and send the child to a doctor. And let's say no. So here are the questions. If they have severe immunosuppression, remember this is one of the things that we asked to be a contraindication. Let's say no. And then any severe allergic reaction to vaccine, let's say no. Next. And then you start inputting the age of the child. In months, in weeks, it's possible. And then here we have only routine vaccination, but we do have having problems now. I'm afraid I cannot proceed. Very sorry. Sometimes we have this problem happening. I'm very sorry. It happens sometimes, and the way around is really I have to wait a bit for next time. I have to check with my IT people. So just for you to have an idea, after this, you have to input the date of the last vaccinations given, like what type of vaccine, which was the date of each vaccine of each dose. And then you have the output finally saying which vaccines you should give today, and then which are the things that the caretaker, the patient has to be attentive for. That a fever can be normal, but more than maybe 39 degrees for more than 2 days, maybe check with the doctors, etc. And then when's the next time to get the second or third dose of which vaccine. Sorry, I cannot show you all the rest, technical issues.
No worries, that's totally fine. I think before we transition to the next part of your presentation, we would allow the community members to share any questions. So feel free to unmute yourself and share any questions.
Hello.
Yeah.
Yeah,
Cliff,
thanks.
please go on.
Yeah, thanks for the wonderful presentation. I mean, mine is just a simple one. Is this configuration code available, public or private?
Yes, one thing that I need still to show you, it's a bit the results of the pilot test that we did. So the pilot test done like 2 years ago was saying that there was still some things to fix, which we finally did this year. And we want to test it again to be sure that everybody is satisfied before making it available to the community. We have the philosophy that everything that we do, it's for the common good. So we will definitely make it hopefully soon in the future available for everybody to use the code.
Sure. Thank you.
Welcome.
Yeah. Maybe just the second one. Documentations about the workflows.
Sorry, I may not have understand well the question.
I was just asking about the documentation about the workflows.
If it's a technical question, I would not be able to answer. I'm a medical person. But the workflow, what I understand as a medical, it's more about how the patient comes and goes, how it's being used in the normal workflow of the hospital or health facility. Is it about that?
Yeah.
Okay.
Like workflow of why a patient goes through from this, which form is filled and all that, if there are integrations with other systems and all that. So more like in documentation format.
Okay. In the places where MSF has vaccination activities or gives support to Ministry of Health vaccination activities, if it's inside a health center, normally it's a separate dedicated activity for vaccination. Maybe the child comes for ambulatory consultation or anything else, and then it's directed to this vaccination service. So the CHT solution is being used in this specific service, vaccination service, and that's for outpatient use. Then, like I mentioned, it can be used for inpatients. And what normally happens is the child, when they're in, I don't know, malnutrition ward or pediatric ward, before they are discharged back home, when they are cured or better with their health, then before discharge, they check the vaccination card. And normally also it's a specific nurse for vaccination that goes to check the cards of the children that is going to be discharged, and then gives the vaccine. So we will give the user will be this vaccination nurse normally. And then when it's maybe an ambulatory service for migrants or elderly, etc., then it's integrated into the consultation. So the consultants will have access to this, to the device and CHT. In vaccination campaigns, then we give to all the people prescribing vaccination to use the module. I hope I had answered the question.
Yes, that's clear.
Thank you.
All right. Because of time, I have a question, but we can share it later after your second presentation.
Okay.
So we can move to the second part of your presentation.
Yes. So it's about the pilot results of eCareVaccine. Next slide, please. So we had done our first pilot in Central African Republic in Bangassou. Here, sorry, it's in French. So just for you to know, the first table on the left up, it's about indicators of the quality of the service. So the red, it's the baseline. It's before they use eCareVaccine. And then the yellow, it's after 1 month of use normally. And you can see that the assessment of contraindication, like the medical person asking if the child has allergy or has a severe medical issue, etc., was more complete on when they use eCareVaccine. The explanations given to the caretaker was more also complete with eCare, and then explanation about when the child should come back to receive vaccine and what's the importance of the vaccination card. It's also more complete when you use eCareVaccine. Then about the analysis of the prescription, how much they are correct, you can see that undoubtedly with eCareVaccine, it's much more complete. The vaccination, it's more correct, the prescription of vaccination on the table on the right side. Then on the below, there is a table about the user experience. So most of the users, the health workers using the module, they said it was easy and increased the speed of giving vaccine and prescribing the vaccine. And they don't agree that it disrupts the communication. The problem is that of speed. So we had like I just showed you when I was doing the presentation, is that in certain place it gets stuck. And this was a bit of the issue that we have during this pilot, and this needed to be corrected. So we have the user satisfaction enough that they'll continue to engage with the module. So this is the part that we try to resolve this year. Can you go next, please? And that's all I wanted to show you about eCareVaccine. My second presentation is about the peer-to-peer feature of data transfer. So I don't know if I do it right now or I take more questions about eCareVaccine.
You can just proceed with a P2P, and then we will take the questions later.
Okay. So this is a feature that was developed some time ago, also specifically inside MSF. It's not about eCareVaccine specifically. It's about the data transfer when we are in places where there is no internet connection. How do we do it? So when you have people working in a health facility that is far from an internet connection point, and these tablets are difficult to take them regularly to the internet connection point, we made a solution that you can transfer the data from one tablet to the other, and then this second tablet, then it can be used only to take to the internet point. So several tablets can transfer to this one tablet, and only this last device needs really to synchronize to internet in order to transfer the data. So I'll show you in details quite quickly. You can go next, please. So if you have the visual of CHT, so we have implemented we have implemented a way that people can click in this download data and wait until download is completed. Next, please. This is on the tablet without internet access. Then they have to turn on the Bluetooth. Go next, please. Then searching files of the tablet where they did the consultation with the CHT module. Next, please. And then open downloads. Next. And then open the file where there is the data. Next, please. Then they have to select the file. Next, please. And then share with the Bluetooth. Next, please. No, it's fine, it's Bluetooth. Next. Then you have to select the device that you are transferring to. So this will be the device that is going to travel later to the internet access point. Next. And then in the tablet, which we call the supervisor tablet, the one that is going to travel later, they have to turn on the Bluetooth as well. Next. Then they have to accept the file being sent by the consultation tablet. Next. And then they finally travel with the device to the internet access point, and they turn on the internet. Next. Then with the internet, they can upload the data. Next. And then they select the file. Next, to be uploaded. And then they have receive the message that upload is successful. Next. Then in the reports tab, they can see all the consultations now that have been uploaded to this tablet with internet access. Next. Then you have to just verify these are the correct consultations to be transferred. Next. And then you have only just internet, and you will be automatically data sent to the server. And that's it.
All right. Thanks for the great presentation and demo. I know we have a lot of questions, so I think it's the right time to get additional questions from the community members. Just to pinpoint, I can see Katanu here who was interested in the offline sync feature. Do you have any questions to ask?
Hi, Anthony. Sorry, I'm just joining now, basically a few minutes before the peer-to-peer discussion. That's a great one. Thank you, Chang. Sorry, I don't know how to pronounce your name. For the presentation. I'm sure I have some more questions that will come after I internalize this a bit, but this is so exciting. Currently in Kenya, that is our biggest problem, that our health workers are not able to to sync or to send reports of the work that they have delivered to the higher levels. And we are wondering how we can be able to facilitate that.
Yeah, that's perfect. Yeah, it's what the same problem we have. That's why we developed this solution. Then I don't know. I would have to ask my IT counterpart if this solution has been shared in the community. I don't know if CHT you would know if it has been shared already or not.
Yeah, it has been shared. Josh and or Ashley, would you like to respond to that? I think Marco shared a PR for that, or is it pending?
I know that there is a forum post out there that kind of details a discussion there. I don't think we've gotten all the way to a formal pull request yet in terms of the code. It's definitely a direction that I think a lot of people are interested in going, and functionality that a lot of people are interested in getting integrated into the app in some way. But yeah, I think the forum is currently where those conversations have taken place. Yep, and thank you for posting those links out there.
All right, thanks, Josh. Jackie, I can see your hand is up.
Yes, thanks, Anthony. Thank you so much for that great presentation. Perhaps maybe my answer would be in the documentations if I go to read through them, but since we're here, if you have an answer, or Josh, you can just let me know. So for the device that is transferring, once the supervisor device syncs upwards, does the device that made the actual initial report get that in the reports tab, or does that only happen to the uploading device?
Maybe I can answer that one if I understood well. So the device that has been used for making the consultation, they have the data stored about the consultations done by this device, and in the report page it will show those. So this one has nothing to do with the data transfer to the server or to a second device.
Okay, great. Actually, that makes sense. Okay. Thank you very much.
Welcome. Then the second device that would gather the data from the different devices, then it will show in their reports tab all the data that they have gathered.
Thank you for the great presentation. I have a related question about the device that does the actual transfer to the server. Are you using the same device for multiple transfers? That's question number one. Question number two, is the user that is logged into this device an online user or an offline user? And if they are an offline user, is there a concern that they would end up with too much data on their device because they have gathered data from multiple devices?
So the device that had gathered all the data from the different devices, it has necessarily to transfer the data to the server by online. At least this is the way that we conceive it. So once the data is transferred, it seems like that is a cleaning process, automatic cleaning process. So in the end, it doesn't stay with too much data in that device.
I understand. Thank you. So the user that is logged into the transferring device is actually an online user, like a user that requires internet connection to access the application.
Yes, yes.
Thank you. Thank you so much. Excellent presentation.
Welcome.
Excellent.
Great.
All right. Any last question in a minute before we move to the next presentation? Simon.
Yeah, thank you for that presentation. Just one question related to the data transfer. I'm just curious if there is any bidirectional syncing that happens. So if there are any updates to the workflows, how does the user in the community get that update? Do they also pull that from their the supervisor, I'm assuming? Over.
Okay. So there is always the possibility to get the device that normally is not connected to a point of connection, but these updates in the content of the modules, it doesn't happen very often, maybe like maximum once a year. So we can spend once a year to take one of the devices to the point of internet connection and have it updated. Otherwise, the device that can travel normally, it can travel also with the update version and share it as an offline, the APK. So they can transfer the APK of the now updated the module to the different devices as well, as offline, in an offline mode.
Yeah, thank you very much.
Welcome.
Right, thanks. Dr. Nansin, I think from the conversation, you still need to come back. I think the community is really interested to learn more about this deployment. So we would be looking for that opportunity. Otherwise, thanks for that great presentation. We'll also be reaching out to learn more about how you manage campaigns. That's one of the priorities that the community is interested in, based on these documents. And yeah, and we're also looking forward to you open sourcing the application so that the whole community can be able to benefit from the great work your team has done. So thanks for the great presentation.
Thank you for the opportunity to speak here, and I'll check right now with my IT counterpart if the code can be already accessible for the peer-to-peer transfer. Thank you.
All right.